Hi, I'm John O'Hurley, and you're watching Human Resource Executive Online.
From September 21st to 23rd, hundreds gathered at the Gaylord National Resort and Convention Center in National Harbor, Maryland for the 21st Annual Benefits Forum and Expo. With the rising cost of healthcare a main issue for employers, former Speaker of the House Newt Gingrich says that companies should try to get their employees engaged in their own health.
So part of what you want to do with your own workforce is look at how engaged are they, what's their experience of things, how much responsibility do they feel, to what degree are they empowered. And there's a difference between let me punish you into change, let me empower you into change. They're very different attitudes. And so you want to, at one level, have a conversation that starts with the individual, because if your workforce proactively engages and manages its own health, it has a better outcome with less absenteeism and less presentism, and it's less expensive. As we looked at the political debate's almost always about money. It's almost always about the uninsured, or it's about how do you restructure the tax code. But in fact, our argument is that money is the last box. It's the fourth box. And it's the thing you ought to think about last.
Out of public office and now the founder of the Washington-based Center for Health Transformation, Gingrich touted electronic medical records and said hospitals need an ever-evolving collection of best practices.
So part of what we're looking at is, can you identify best practices? And can you migrate the system to best practices? And one of the things I'd encourage all of you to do is, look, we have a project for HR programs at the Center for Health Transformation, where we are actually working with Microsoft to develop a web-based system that will be kind of like an eBay for HR managers, but designed to say, let's get all the best practices around the country in one place, and let's look at how you would do that. It'd be very interesting if you think you've got some ideas, if you A, have some ideas you'd like to offer as your best practices, or B, if you have a couple of problems you really wish you could find the best practice for. We'd be very interested in knowing both of those, and we're at healthtransformation.net. It's astonishing how big the differences are. And our core argument is, if we had the same pattern in health that we have in manufacturing, where over time you have to migrate to best practices or you can't survive,